Hey everyone, I'm Anastasia. Joining us at Straight Talk, editor of Modern Hygienist, and today's guest is Patti DiGangi. Many of you dental hygienists know who Patti DiGangi is. She's a dear friend and colleague of mine. She has started her book on codology, thank you Lord, to help get us through insurance. But you know, a couple of weeks ago, Patti DiGangi co-authored an article with Shirley Gakowski, and if I said that wrong, Shirley, I do apologize. And it was basically on the Millennial Hygienist. It created so much controversy that I just felt, you know what, our audience needs to hear it. This is great what you placed out there, Patti, but you know what, too, we'd also like to know, all right, I myself live in a more rural area. It's more laid back, and I can't practice exactly the way that you said. But first of all, welcome to Straight Talk. Thanks for joining me.
Thanks, Anastasia. You know, this whole idea of where we can do this and how we can do it, really what a modern millennial hygienist is just it's more of a state of mind than anything. And you know, it's like so many other things with change and growth. It's how to eat an elephant one bite at a time. You know, that's an old one, and so is this whole idea of sacred cows. It was really funny as we Shirley and I wrote, and by the way, you did say your name right. We wrote about the 3 reasons not to perioprobe. Oh my gosh. What we're trying to get across, though, is that there's some things we just have to think about differently. You know, we're thinking about them the same way we did when we were in hygiene school. Now, whether that's 3 years, 20 years, 30 years, 40 years ago, it's changed. Yet there's some things that are just, and the idea of the sacred cow is that people, they're almost like they can't be challenged. It's like it's so hallowed that we can't. No, everything should be open to challenge. So you're sitting in your office, and I know, Anastasia, you've done a lot of temping, so have I. I have to get the twitch in the eye when I think about that one. But the reality of it, it can really help determine what kind of professional we're going to be. Like even the term scaling and root planing. That's based on 1960s periodontal philosophy.
Deep cleaning, that's one I hear a lot in this area, at least in North Carolina. And I got to tell you, I mean, deep cleaning, really, how far deep are we going? No wonder people get afraid. I'd be afraid. We're going to have a deep cleaning. I mean, we really do have to restructure the language into 2015. I agree.
Right, you know, and that's funny. Thank you again for mentioning my books. I've written 2 books so far in this series on the dental codology. And those are not, there's coding information that, yeah, we really need, but it's really about where we're going with our electronic health records. And the next one, we're going to talk about that, and it's the evidence-based decision-making. Well, what's the evidence and how do you say it? Because that's the key part of what you said, deep cleaning. Oh, yeah, there's a great term. You know, or even the other part that we do, and that's using the language that makes it too little. Oh, a little bleeding. How much of bleeding? You know, that's the other side of it.
So, just like you said, as far as the perioprobing, and for me, I really do. I mean, that is my gauge. I always share that, you know, we're measuring the health, and it's never, to me, I am shocked how people don't do that once a year. And how are we supposed to impress the importance between health, being oral health, to total health, if we're not updating this? So, I mean, that's something very simple to actually do. But can we read, what's another word for probing?
The children are trying to do with our articles and my work that I do is we need to, you know, before, for a long time, all you had to do was breathe and have a license, and there was a job. Well, that world's changed. So how do we distinguish ourselves in our practice? And just cleaning teeth and doing deep cleanings and probings,
What would you recommend? I mean, like, so take what you've shared right now. There were 2 things that I can pick up immediately. Language, and then the way that we practice instead of breathing and have a license. How do we get into these tough areas? Because it's hard here in the Outer Banks to find a full-time job. What can I do, A, to be happy, and B, bring my value even if I'm unable to provide it? Maybe I don't have oral cancer screening technology, let's say. But
right, well, you know, but we know that oral cancer technologies are an adjunct. So if you don't have the adjunct, it's still based on the thorough head and neck screening.
Correct.
And that's the part. And you know what? You know what a simple thing is? How about in that thorough head and neck screening, you do a little neck massage for somebody. It's hands-on healing. It's the touch, and for some people, they don't get touched any other time. Talk about something that makes you happy. But sometimes it's the simplest things that we do that differentiate us. We are, hygienists really are good at connecting to our patients, because I'll bet that there's a bunch of people listening here that, they've also stayed where they are because they love their patients, even if it's not a good place. So how do we make where we're at the best it can be? Whatever the circumstances. Yeah, there's limitations and there's barriers and all that, but if we stay stuck in those, that's where we stay stuck. Or we can look at all the different opportunities that we have to make little changes that makes you more valuable as an employee. And that ultimately will make you happier as a person.
So just to kind of wrap it up really is knowing, staying obviously current in the profession, and what you're sharing, like when we were talking about the probing and the language, even if you altered your language some, that's going to make a difference in somebody's life. So you would recommend somebody to start there and then keep going forward in the changes as we move forward the year.
As a matter of fact, in February, there's 2 articles Shirley and I wrote exactly on that. The first one is called the 2 F words of hygiene. Everything's floss and fluoride. There's more than that. And then the second one is about 5 words that you can change easily that will help you change your thinking and also helps to change the patient's thinking.
We really can make a difference no matter what place you're at. And I appreciate your time, and I'm looking forward to those articles. Hey, stay warm and dry there in Chicago.
Oh, I'll try. It's tough, 19 inches of snow. But thank you for your time too, Anastasia. We'll look forward to seeing you again.